Welcome to today's webinar. The topic for today is FAR UV 222 nanometer in long-term care, shedding new light on infection prevention. My name is Karl Seagren, and I'll be hosting today's presentation. As a reminder, this webinar is intended to provide general information, but not legal advice. Please also be aware that we are recording this webinar. We have a great expert joining us today, and I'm honored to introduce him. Kevin Bergmann is the president of HomeLike Solutions, LLC, and has 12 plus years of experience deploying innovative technologies into healthcare. He is passionate about helping healthcare providers utilize technology to drive better care and create safer environments. Highly skilled in product development, launch, and staff training programs, and with expertise in ultraviolet germicidal irradiation, he has been intimately involved in developing multiple new technologies designed to create safer and pathogen-free environments for healthcare providers and their patients. He's now worked with major healthcare systems and their infection prevention leadership teams across the country to implement UVGI technologies into their clinical workflow and develop standard best practices. Kevin, I'll turn it over to you.
Thank you so much, Karl, for the introduction, and thank you everyone who's able to join us here today. I want to first off thank you all for your continued dedication. The past few years have been incredibly challenging for healthcare workers, and we appreciate you. And certainly I'm excited to share some technology with you today that can make a big impact in not only saving lives, but hopefully on your bottom line as well. So with that being said, dive in here to the problem with that's facing healthcare communities and has for as long as they've been in existence, and that's healthcare associated infections. An AMA study recently showed the costs of these, and it ranged in $35 billion annually, $22,000 per healthcare associated infection, and created almost 100,000 deaths globally. And it's important to note that although healthcare acquired infections have costs associated with them, the real important reason that we are deploying technology like we're talking about today is to save lives. And when we talk about disinfection and why it's needed now, I think we can all agree pathogens are an age-old phenomenon. They cause millions of global deaths annually and trillions of dollars in disruptions and economies and markets across the globe. Although COVID has been at the forefront of our minds, and rightfully so, the past few years, pandemics are nothing new. We've had SARS, MERS, H1N1, Ebola, to name a few, and we can be sure they're going to continue. And even within healthcare facilities and long-term care settings in general, influenza can be extremely deadly. A recent CDC study in 2019 found that up to 70% of flu hospitalizations were in people aged 65 and older, and up to 90% of those hospitalizations that resulted in death were in people 65 and older. So, we are certainly all aware of the deadly consequences influenza can have in a senior care community or healthcare community in general. And one thing we have continued to see, whether it's influenza or more recently COVID, is that they will evolve and mutate into more severe-borne pathogens and create challenges to healthcare operators across the globe. So, reverting back to our processes of the past pre-COVID is not going to be sufficient in helping prevent and treat future pandemics. So, it's important that we ensure perpetual biosecurity to control the introduction, multiplication, and spread of pathogens in both acute and long-term care healthcare markets. So when we talk about, ultraviolet germicidal irradiation, it's important to start with what is UV light. Most of us are familiar with the universe's biggest producer of UV light, the sun. For us here on Earth, UVA and UVB cause, for most people, sunburn or where they get their tan from. It reaches Earth's surface. UVC, fortunately for us, is absorbed by the Earth's ozone. UVC is a form of electromagnetic radiation with a wavelength between 100 and 400 nanometers. It's invisible to the human eye. It's shorter than visible light, but longer than X-ray. So, falls right there on the spectrum. When we talk about how does ultraviolet germicidal irradiation work, it's important to note that UVC inactivates microorganisms by mutating their DNA and their RNA. When that happens, cells cannot grow or reproduce. When they can't replicate, they are no longer infectious and cell death occurs. For my fellow microbiology nerds, it's important to note UVC inactivates microorganisms by absorption of that radiated electromagnetic energy. What happens is the light penetrates the cell wall, causing pyrimidine molecules such as thymine to cross-link and cause a dimer in the DNA. That dimer then impedes the nucleic acids and prevents the organism's ability to continue cell metabolism, thus inactivating the microorganism. When we talk about UVC germicidal irradiation in a healthcare environment, it's important to note that UVC inactivates all forms of pathogens. You see here on this slide, I've listed quite a few. Candida auris is a one making its rounds here in the U.S. and becoming more frequent, especially in senior care and acute care settings. But it's important to note it's not just a knee-jerk reaction to COVID or SARS-CoV-2. It is truly a game changer in fighting the battle against all pathogens that might be introduced into a healthcare environment. A fun fact is there's actually no known pathogens that are resistant to UVC because of the way that it impedes the nucleic acids and penetrates the cell wall to inactivate it at a RNA and DNA level. When we talk about UV, it's important to note that the germicidal effects are nothing new. The powerful germicidal effects of UV light was discovered back in 1877 by British physiologist Arthur Downes and Thomas Blunt. You see here on the slide, it was introduced into hospitals as early as 1936. It was used in air handling systems as early as 1940. Was also used to fight tuberculosis. And then more than 20 years ago, the CDC actually endorsed the use of UV-GVI in hospitals. So, important to note, it's not new. We've long studied the effects of UV light on different pathogens and microorganisms and have known for a long time its capability to be a protective technology. So, now that we've established that it's not new, what has changed over the last 60 or so years? And that's the delivery systems, right? Whether it's 254 or 222 nanometer UV disinfection, the delivery systems have become easier, more transportable. They've become more durable. And of course, they've become safer and more reliable with measurable results, which when I get into later, the 222 nanometer wavelength is actually safe for human skin and eye exposure. So when we talk about why healthcare operators should implement germicidal UVC technologies, it's important to note, and especially in the past, few years specifically, you've probably been overwhelmed with all the different new infection prevention technologies that come out, whether it's static spraying, bipolar ionization, HEPA filters, fogger systems. You've probably been inundated with quite a few of these. And it's important to note, it's not an and or with any of these. There's no silver bullet. But it's important to take advantage of the technologies that are out there and affordable to healthcare operators. So how do we build the best system for our patients and our residents and take advantage of all of these technologies? It's certainly not designed to replace any of them. But when utilizing UVC, it is important to note some of the advantages. One being that UV light, same as visible light, travels in straight lines in all directions. So it eliminates human error for any of the surfaces the light comes directly in contact with. When we talk about the application of liquid disinfectants, your staff is often overworked, tired, working long hours. Did they touch all the surfaces? Did they let the liquid disinfectant seal long enough to achieve germicidal effects? So there's a lot of moving variables. And then the other advantage, of course, is that it's environmentally friendly. We're using light here to combat pathogens. It does not have reoccurring costs. One of the other, real benefits that I see and that the scientific community sees is in the use of ultraviolet germicidal irradiation is the prevention of superbugs. Sir Alexander Fleming discovered the germicidal effects of penicillin back in 1928. But he warned, and there's a quote here that you see that, microbes can easily mutate and become resistant to penicillin. That's why antibiotics today require a prescription. But he warned that it's a temporary fix and that, humans need to be cognizant of the use of antibiotics, when it comes to drug-resistant bacteria formation. So we truly are facing a war right now, and that war is on superbugs. Pathogens continue to mutate and become resistant to chemical disinfectants. This includes bleach now with certain pathogens, and antibiotic-resistant bacteria is becoming more and more prevalent as antibiotics are misused. The World Health Organization estimates that over 700,000 people each year die as a result of drug-resistant bacteria infections. And an even more eye-opening number, the UN actually estimates that number is expected to grow to 10 million deaths per year by 2050, which is a staggering number. That's more than cancer or heart disease. And so it's not really a matter of if, but when, if we don't take precautions to prevent some of these things. And the reason, antibiotic resistant bacteria is becoming more prevalent is because microbes can develop better outer shields. They can put pumps in to block antibiotics, and they can create weapons that destroy antibiotics. And as these bacteria acquire these defenses from small changes in their DNA, they then share that by passing along plasmids. And so ultimately, misuse of antibiotics clear out the weaker, defenseless bacteria and eliminates the competition, allowing these drug-resistant bacteria to flourish. And so UV disinfection is a viable option to help prevent and stagger off, the increasing frequency of drug-resistant bacteria. So today, obviously, we're going to dive into the far UVC, the 222 nanometer technology that is real leading edge technology. But before we do that, we want to understand the traditional 254 nanometer UVC technology that you may have seen, or may be using currently in your communities. Typically, these are shown or utilized in the form of cabinets or chambers, which are great for hard or shared devices, tablets, phones, radios, pens, anything with a hard surface that might be shared among staff or residents. The next step up from there, we see for room disinfection, we are typically deploying a stationary tower that is rolled into a room. And then, of course, last but not least is the autonomous robot, which moves around the room autonomously to get closer to all these surfaces and a higher log reduction. Before I dive into these specifically, there's a couple things we want to make sure we understand about UV light. It's governed by the same laws as visible light. The first one being that it travels in straight lines in all directions. So it will not bend around an object. It will not get into shadowed areas, and will not reflect. Will lose significant intensity if it reflects off the floor. So that's important to note. It's also important to note that dose is calculated by the intensity, by the length of exposure time. Last but not least, the last part of physics that's important to understand with UVGI is that that UV light is governed by the inverse square law. So at 1 meter intensity, you have 100% intensity. When you move back to 2, it's a quarter of that, and so on. So this will come into play here on the next couple of slides when we talk about deploying these type of technologies. So the traditional 254 stationary towers are cost effective. They become easier to transport, really designed to be remote operated. They can measure the dosage in the room. But one of the drawbacks in comparison to robots is that they typically require a little more staff labor. They have to be repositioned in a room several times to achieve a similar log reduction as a robot. So they're certainly more affordable. If you're evaluating these technologies right now, it's important to keep in mind practicality as well. The shiniest, most futuristic looking tower out there may not be practical in a long-term care setting, right? We all know how equipment gets banged around in hospitals and in nursing homes. Our med carts, our trash carts, everything is banged around. So, practicality, I think, is important if you're evaluating these type of devices. The next step up from there is the autonomous robot. The autonomous robot moves around without interaction. Circling back to the laws of physics, this robot or robots that are similar move around the room to get closer proximity to the surfaces, especially high contact areas. It can disinfect a room in 10 to 15 minutes. Most of these technologies have significant tracking and cloud-based reporting. But the important part here is you're reducing your labor in a long-term care setting. You're not having to go back and require a staff member to reposition the tower to get a higher log reduction in the 6 to 7 range. So can also be useful if you are facing a certain pathogen or a specific one that is present in a room. You can always send the robot in first before doing a terminal clean to keep them safe. All right, so now that we covered the 254 traditional ultraviolet germicidal irradiation technologies, I'm extremely excited to show you the far UVC 222 nanometer technology. The big difference here, if we can break it down, is the 254 we just discussed requires humans to be out of the room. It can damage skin and eyes at the 254 nanometer wavelength. What was discovered back in 2012 by world-renowned physicist and the director of radiological research at Columbia University, Dr. David Brenner, was a shorter wavelength that is not harmful to the skin and eyes, but still has the same or similar germicidal effects on pathogens. It's important to understand pathogens, microbes, viruses are incredibly small and very easily penetrated by UVC light in comparison with, human and biological makeup. So what Dr. Brenner was able to create and develop was an excimer lamp. It was a high energy krypton chloride encapsulated in quartz glass that creates a dielectric barrier discharge. So this creates that UV at that length. And the important thing that he also developed was a band pass filter system. And this is important when evaluating FAR 222 technologies because it creates a safety barrier mechanism for you. So if you see there in the illustration, typically at wavelengths at about 230 nanometers is where it starts to penetrate the proteins and in the skin and eyes of humans. But it's also important to note that this band pass filter prevents the wavelength from going below 200 nanometers, where UV light can potentially interact with oxygen and create ozone. So it keeps it in that safe, sweet spot to ensure that it's safe to deploy in any healthcare setting. When you talk about why we want to use far UVC, it's important to note and make note of dosing, and that's measured in millijoules per centimeter squared. That's the amount of radiant energy per unit area. And what Dr. David Brenner was able to discover was that at 222 nanometers, only relatively small doses of over time are needed to inactivate different pathogens and reduce the pathogenic bioburden in a healthcare environment. So on to the explanation of safety in human skin. If you look at the diagram here on the right, you'll notice UVA and UVB, which is present at Earth's surface. It's where I get my sunburn from, is able to penetrate down into the epidermal layer and even sometimes into the basal stratum. But if you look there, 254 as well can get into the epidermal layer, but 222 is fully absorbed in the stratum corneum layer, which is compromised of dead cells. It's not reaching any living cells and thus not a danger to humans when exposed to it in a healthcare environment. When we talk about the safety in the eye, similar situation where at 254, the traditional UV lights that you can't be in the room for, they can cause keratitis in low dosages. But 222 is fully absorbed in the tear layer and cornea and does not reach the lens. And those 222 does not get deep enough to tissues that are associated with cataracts, photokeratitis, or other damaging eye conditions. So again, shorter wavelength has better photon or higher photon energy, but is more easily absorbed. So when we talk about, the governing bodies, it's important to note that the American Conference of Governmental Industrial Hygienists sets the TLVs, which are the threshold limit values for UV exposure over an 8-hour period. And previous to January of last year, it was thought that standard per dosing was at 22 millijoules per centimeter squared. But after significant research and studies, the ACGIH improved those or increased those to 160 millijoules per centimeter squared for the eyes and 479 millijoules per centimeter squared for the skin. So significantly safer than previously thought. ANSI photobiological safety standard recently voted that into place and referenced these standards as well. There's an update to UL 88002 that is in the works. So, with all the research and study that's been done over the past 10 years, it is found and known to be much safer for humans than previously thought. Want to show you this slide. So, we just talked about, the eyes being 160 millijoules per centimeter squared for TLVs and the skin much higher. But you see here, and there's a lot of information on this slide, but you see the doses are significantly smaller to inactivate whatever pathogen you might be facing, whether that's MRSA, whether that's C. diff, Candida, and as I get into here, the next slide, some common virus or common pathogens you may face in a long-term care or acute setting. You see there MRSA requires only 15 millijoules per centimeter squared, C. diff around 30. The surrogate for norovirus there is at 24. And then, of course, influenza A less than 6, and SARS-CoV-2, which obviously is at the forefront of everybody's mind, is less than 5 there to penetrate and inactivate those pathogens. So significantly smaller than any dosage you might be required to have, or significantly lower than the TLVs that were established recently. So the next slide I want to show you here is another study that was done. It was five far UVC fixtures installed in a room-sized chamber. The top line there, the medium, which is the red on the graph, was the previous TLVs, the 22 millijoules per centimeter squared. The blue is the most updated. And you see the blue had a pathogen reduction load of 98.4%, which is the equivalent of 184 air exchanges. So IAQ has been a topic that has been brought up quite a bit as of late. And, by deploying this technology, you're achieving 184 equivalent air exchanges, which is pretty significant. Another study or slide I want to show you here is the efficacy in regards to a study done on influenza A, or the H1N1. And you see there the irradiation time compared to the distance away of what it took to get a log 2 and a log 3 reduction. So again, the idea with far UVC is relatively small doses are able to get significant reduction in pathogen load over time. So now that we covered the science behind it and the efficacy, it's certainly time to talk about considerations for implementation here. So, when implementing this in a senior care environment or an acute care setting, there's different units that can be deployed. You see here, there's a wall mount unit that are typically plug and play. There's can mount units that can be put in the hallways and drop ceilings or hard lid ceilings. And there's even pendants that are a little more aesthetically pleasing for lobbies and common areas that might have higher ceilings. But when evaluating different far UVC technologies, it's important to note the coverage plot, right? So the direct supply PureScape Technologies covers a 400 square foot zone. You also want to consider mounting height. You want to cover power source. Are they going to be plug-in, or do they need a professional installation? Does it have the band pass filter that we talked about earlier? There's a lot of different technologies coming from overseas. You want to make sure you are using a technology that has that type of filtration system. And then, of course, is it app controlled? So I will show you here. The benefit of using an app makes installation easier. Having an app that can set a duty cycle for you. So most of these far UV technologies need to be mounted at 7 feet or higher, specifically the PureScape product. At 7 feet, you have a 15-second on, 45-second off duty cycle to stay within those TLVs. When that moves to 8 feet, that goes to 30 seconds on, 30 seconds off. And when you get above 9 feet, you can cycle it at all times and remain below those TLVs. So, it's important for ease of use installation when evaluating these technologies to make sure you have an app like that if you're not utilizing a professional installer. But the other important part is the being able to prolong bulb life and get the highest ROI on your investment. So bulbs are rated for 10,000 hours with the Ushio products that you see here today. But using an app can determine scheduling. So are you turning the bulbs off during off hours when you don't need disinfection? And are you getting a longer bulb life out of that versus some technologies that are just constantly on at all time? You're not going to be able to manage that schedule, or it might be difficult to manage those schedules. So using an app to manage those duty cycles can be a big return on your investment when it comes time to replace the bulbs. All right, when it comes to measurable results you can see, it's important to note whether you're using 254 or 222 nanometer wavelengths, is we want to ensure efficacy, and being able to do that with a dosimeter is a powerful tool when evaluating these technologies. So essentially how these work is they stick to a wall or a surface that in the range of your equipment, and they will change color based on the dosage delivered. So in this case, getting to the orange shade gets you a 25 millijoules per centimeter squared, 50 at the next shade, and then all the way up to pink will give you 100. And as we showed on that chart before, this ensures that you're hitting the doses required to combat whatever pathogen might be present in your healthcare community. The PureScape bulbs are rated for 10,000 hours, but can achieve up to 70% efficacy to 15,000 hours. So tracking these technologies is important when it comes to ensuring efficacy. All right, so when we talk about deploying these in a long-term care setting, we have a wonderful site out in Seaside, Oregon called Suzanne Elise Assisted Living. They actually put the PureScape product in all of their hallways and common areas. But when you're evaluating where to put it in your community, obviously budget is always a concern, but you want to make it in high traffic areas where people gather. Common areas, hallways, entryways, front lobbies, and of course, employee break rooms, right? Loss of productivity when infections spread between staff. I know you all have dealt with staffing issues long before COVID, and it's only been exaggerated, the seriousness of staffing as a result of that. So, making sure we're keeping our staff healthy and in healthy environments is important, but also food prep in your kitchens, in your dining rooms. We recently conducted a surface swab testing at a long-term care facility, and no shock to anyone, the tub rooms was one of the dirtiest or had most pathogen intense areas of the community, but also your medication rooms, your soiled utility, public restrooms, or maybe where you keep shared equipment, pharmacy carts, things of that nature. When we talk about far UV in a acute care setting, it's important to note that we can deploy them just about anywhere, but the common areas where we're seeing a lot of usage right now is emergency department, waiting rooms, urgent care centers, ORs are probably number one. The common areas, the emergency rooms, the step down areas, ICU, compound pharmacies, and of course, sterile rooms. So when I circle back to far UVC and why you want to use this technology, the important part to note, it's not there's no silver bullet in infection prevention. So, the unique part about far UV is that it's constantly on and disinfects and can prevent contamination on both surfaces and the air. Right now, in a lot of states, there's grant money out there that's focused on indoor air quality. So be sure to check with your local authorities. In addition, it's fast, chemical-free disinfection. It's eco-friendly. It's mercury-free. UV light is actually part of the well building standard. So if you're evaluating and building new buildings, this is a great technology to incorporate into that. And of course, we talked about preventing superbugs and mutations and how that is going to be an incredibly serious issue if we don't start deploying technologies like this. The other component of this is that it can help support patient satisfaction surveys, improve your HCAP and leapfrog scores. And lastly, the marketing component, right? So being able to showcase to your community and help build your census that you are deploying these leading edge technologies, that your competitors down the road may not be doing to create a safe environment for people's loved ones. That being said, I've got a little testimonial from the Suzanne Elise building that we discussed earlier.
Good day. My name is Beth Van Elswick, and I'm the Director of Sales and Community Outreach here at Avamere Suzanne Elise Assisted Living in Seaside, Oregon. My first experience with PureScape's Far UVC was actually when I was moving my grandmother to an assisted living community, and I was doing my research, and the Far UVC jumped out at me, especially during a pandemic. This amazing technology that was providing this extra level of non-invasive, amazing safety at a time we really needed it, especially for immunocompromised folks like my grandmother and other senior citizens. Now, as director of sales, my tours, it's something that I show off, and 8 out of 10 times people are on their phone Googling it and following up with questions. In community outreach, it comes up in conversations, and I happily share my personal opinion of how incredible this technology is, how widespread it's accepted throughout Europe and the world, and we need to do some catching up here. So I am a big fan, personally a big fan of PureScape's Far UVC. I use it when I do my tours, and I'm thrilled that it's here where my grandmother lives. So PureScape's Far UVC, something I definitely support.
All right. Kevin, that was a fantastic presentation. A lot of good learnings here. I took away a lot of stuff, and I'm sure all of our audience members did as well. We're now actually going to be moving to the Q&A portion of the webinar. So folks in the audience, you can ask a question by clicking on the Q&A icon on the right side panel. You can also upvote a question that's already been asked by selecting the up arrow to the right of the question. And it is important to note as well that if you have been watching in full screen, you'll need to exit the full screen mode to access the Q&A. All right. See if we can get our first question here. There we are. So Kevin, do you recommend using both standard UV along with far UV, or is it a one or the other situation?
Yes, absolutely. As I alluded to before, there is no silver bullet when it comes to infection prevention. It's how do we create the safest environment possible? And how do we utilize all the technology out there to create safer environments? And so, 254 certainly has its advantages when it comes to surfaces and lower areas in the room. But it's really about building a system, and using the two together is going to create the safest environment for you. So, the benefit obviously of far UV is that it can be constantly cycling and creating safer environments. UV 254, you have to be out of the room, but it's about building a system, and both play an integral part in creating safe environments for long-term care operators or hospital.
Well, that makes good sense. Like you said before, there's not a single silver bullet in the world of infection prevention, for sure. So that makes good sense. Next question. Do the surfaces need to have a direct line of sight to the device for it to be effective? And I think this is probably related to far UV, but you can speak to it related to traditional UV as well.
Well, both. They're both governed by the same laws. So that was the physics slide I had on there. So it travels in straight lines, right? So it does have to be has to be in the direct line of sight to reach it. It will not bend or get around shadow areas. And reflection really reduces the intensity. So yes, it does have to be. And that's where utilizing both 254 and 222 can help eliminate some of those shadowed areas that are lower to the ground.
Oh, that certainly makes sense. All right. What's the cost difference for the different devices? I guess you can speak in generalities here, knowing what you know and all the research you've done and such.
Yeah, there's different costs associated with them, and I think Karl will probably get into those maybe a little later on, or you can reach out to your direct supply account manager. But they're typically in the $3,000 to $5,000 range, depending on which unit you're looking to use.
And how does that, I guess I'll piggyback off of that too, comparing that to a traditional 254 nanometer tower, for example, just to give the folks.
Great question. The towers have become more and more affordable as a result of COVID, which is great. This is technology we want to get into the hands of healthcare operators and create safer environments. So towers can range anywhere from 20 to 120,000, depending on which one you use. As I mentioned before, if you are evaluating those technologies, it's important to note output. The output that whatever device you're evaluating is how much energy it's putting out, as well as practicality, right? There's a lot of things on the market right now that look super futuristic with exposed bulbs and things of that nature that really may not be very safe in a skilled or long-term care environment because they get banged around so easily.
Yeah, no, that's a very good call. We know our senior living operators are constantly talking about how challenging it is to maintain some of their equipment in all facets, but let alone a very expensive piece of capital equipment like UV. So
yeah.
Next question here.
I would just add to that, Carl. In regards to cost, the other huge saving with the far UV technologies, there's no labor cost, right? Once you turn it on, you install it. It's a set it and forget it system outside of adjusting schedules or things of that nature. With the 254 nanometer, you obviously either have to reposition the towers or you can go the robot that moves autonomously. But, when evaluating from a cost standpoint, the labor savings is pretty significant.
That's a great point too. And we know how challenging the labor market is in all areas. Senior living in particular has been hit incredibly hard there. So that's an excellent call out. Thank you, Kevin. I think there was another question here. Yes. So do you know if air duct installs are available in I believe that's, I'm guessing that's related to far UV, but perhaps just UV in general.
Yeah, there are technologies out there that utilize 254 and I believe 222 now in air ducts. I think most commonly 254 because you're not exposed to humans. But yeah, I'm not sure direct supply carries those type of technologies, but certainly get in touch with your account manager.
I would agree there. I know that I have actually seen that that does exist as well. So yes, good question. All right, Kevin, you had mentioned in your presentation that your units or some of the units you've seen can cover 400 square feet with the devices. Is that a per device thing, or is that based on a group of devices? Can you speak to that a little bit more?
Yeah, great question. It's a per device. So it's typically the most optimal germicidal effects occur in a 20 by 20 area or 400 square feet. So, one of these devices can be very effective in a healthcare setting. But yeah, it's per device.
And I suppose that I'll piggyback off of that too. I suppose that if we are dealing with shadowy areas in a space, you might need to have devices on different sides of the room to be able to cover shadowy areas better and more thoroughly as well, correct?
Correct. Yes. And that's where deploying 254 in conjunction as a system with 222 is really going to give you the most optimal germicidal effects.
Sure. Covering those shadowy areas. Yep. Do you have to clean the machine or filter before going to the next contaminated area? Now, I guess I'm thinking with this, and this would be related to the 254 towers.
Yeah, so the 254, obviously the filter is built into the light. That those do not need to be changed. With the towers or robots, you can reach out for best practices, but typically they decontaminate themselves with their own light, but they can be cleaned with pretty much any standard topical disinfectant as well.
And I think the filter thing, it's important to note with as we speak to far UV, that those devices are fixed, so they're not necessarily being moved from one location to the next.
Correct. Yeah. So if you saw there's the wall mount option. Those are typically plug and play, very easy to do. There's the ceiling can that can go in a drop down ceiling or a hard lid, and then of course the pendant. But yeah, those filters, do not need to be cleaned.
Perfect. Thank you. All right. How often do the devices need to be replaced? I think you spoke to a time amount, but yeah, what can you speak to that a little bit more?
Great question. Yeah. So the bulbs, which are made by Ushio, are rated for 10,000 hours, right? So it's going to depend on your duty cycle, which will all be set up either professionally by the team at Direct Supply or with us, or if you're doing it via the app. But the 10,000 hours, is going to depend on what your duty cycle is. Are you running it at night? Are you running it 24/7? Depending on what height you're at, are you running the 15 seconds on, 45 seconds off? So it's hard to say how long, but the bulbs are rated for 10,000 hours. They can achieve up to 70% efficacy to 15,000 hours, but then typically need to be replaced. So ballpark every 2 to 3 years if you're using them significantly.
And I'd follow up on that as well. Then would the device itself, the wall mount or the can light or the pendant, would that device need to be swapped out as well? Or are we talking just the bulb, and is the
Nope.
fixture
Great
can stay there as long as it's not damaged?
Yep, great question. All of the bulbs, they operate on the same lamps, and those only the bulbs need to be replaced. The actual physical hardware and housing unit and technology behind it does not need to be replaced.
That's perfect. That's certainly leads to some cost savings there for everybody as well. Would it be good practice to use the UV lighting daily or weekly, or only when known viruses are present? What's your opinion on that?
Great question. So the far UV technology is designed to be used constantly. Anytime people are gathered together, hallways, common areas, and it's nothing new. The Pentagon's actually using it. It's deployed in airports. Starting to see a push into schools. But the idea is that that it's constantly on and it's constantly disinfecting and creating, reducing the pathogen bioburden in any environment. And in regards to 254 and the traditional technologies, it's a powerful tool, especially when you come across a certain pathogen, whether it's C. diff or MRSA or whatever might be present. But there's no limit. The 254 technology, they're rated between 10 and 12,000 hours, depending on which technology you choose. But, in that type of setting, those are going to last 7, 10, 12 plus years easily. So I wouldn't say there's really a recommended use. Use it as often and frequently as you can. Because as we saw earlier, the cost, it's going to help save lives and it's going to help save your bottom line. So, it's really, truly a life-saving technology.
It certainly does seem kind of like a 1-2 punch, if you will. You've got the passive support of the far UV that can be on while people are living and working. And then you've got the more targeted use of the 254 when you have a specific situation going on, and you can take it into individual rooms to disinfect that space, which is it's a powerful combination, I think.
Correct. Absolutely.
Now, you did mention, Kevin, the installation in a tub room. Can the lights handle the damp air? Okay, is that going to cause a ruckus with them in any way?
Yes, the lights are fully enclosed. So, you definitely don't want to put them in a line of a shower head or something of that nature. But, that's obviously, like we talked about, we did a recent surface testing and it was one of the dirtiest areas. So, mounting it above that 7 feet is still going to give you great efficacy and we'll be able to handle that moist environment.
Good. Thank you. Can you discuss the services associated with the different unit types?
By surfaces or services, I assume you mean installation and implementation. So
I'm going to assume so here too. Yes.
Okay.
The person that asked this question wants to add additional commentary into the chat. That would be helpful, but we'll assume that for now, Kevin. Yes.
Yeah, I'll go with that. So with all of the towers that is offered by Direct Supply, it comes with training and certification for your staff. That the towers are the 254, obviously cannot be in the room. The robots are a little more extensive. An install team will come on site. They will map your community for you, and then create super users and train them on how to operate the robots. There's also service agreements available with that, being a robotic solution. And then on the far UV side, there's a couple different options there that we talked about. It's as easy as the wall mount plug and play that you can do with an app yourself, or we have professional installation teams, most typical, that will come on site and do the installation for you, and provide that service. The app also tracks usage and hours, and users to make sure that you are going through the proper preventative maintenance on these products.
Oh, that's great. That sounds pretty comprehensive, and certainly will keep the end users and those that they're caring for safer as a result, knowing how to use things properly. Grant programs. This is a great question. Are there any known grant programs to help with the cost of this technology that you're aware of?
Yes, there certainly is a number of grant programs. There's a number of grants focused on IAQ, air quality. So reach out to your direct supply account manager. We've been working with them with some CMP grants and some local air quality grants. So yes, the important part to distinguish here is the far UV, because it's constantly on and cleaning, typically qualifies for air quality grants, whereas the 254, even though it does disinfect the air when you run it, as soon as you remove it from the room and reintroduce a pathogen, it's not constantly disinfecting the air. So the 222, the PureScape, the far UV has the benefit of qualifying for some of those air quality grants.
That's a good call out. And in fact, I think that Susanna Lease program, and when they invested, they used some grant money to do their project there too. So
they did, yes, in conjunction with direct supply. So that was a good project.
Absolutely. All right, I think this might be the last question, unless a few others come in afterwards here. How visible is the far UV light? Will it turn the room blue?
That's a great question. I'm glad you asked. No, it will not turn the room blue. They actually give off a very small purple shade, if you saw on the slides there, but it's not designed to replace lighting. It's not going to illuminate or provide visible light in a healthcare setting. So they do put off a very small purple light, but not by no means going to turn the room blue. The 254 nanometer technologies does produce a glow, but obviously will not have people in the room when operating those. And that's actually just a creation from the bulb. The actual UVC light itself is invisible to the naked eye.
Good call out. Good call out. All right. I think that is that's the end of the questions that we have at the moment. If additional questions come up, feel free to input them, and we'll be able to follow up with the folks that ask them after the webinar. But great questions, everybody. Thank you for that. And Kevin, thank you for your expertise. We really appreciate everything you have shared with us here today. We are at this point going to move from into the product portion of the webinar, and we certainly hope you can stick around. I'm going to kind of, over the next couple of minutes, I'll cover a little bit more about what is available to you all through direct supply. We have over 1 million products in our offering, the broadest in selection in healthcare, and that includes a whole bunch of items from a lot of leading manufacturers that you see here on the slide, like Clorox, Lysol, Purell, Diversey, Kimberly-Clark, many more. And I will talk over the next couple of minutes about some of the different products that we offer and the technologies in infection prevention space, including the far UV options that direct supply carries, that will help you really make a robust cleaning and disinfection program as part of your infection prevention program. So with that, I do want to formally introduce the newest addition to the direct supply brands offering, direct supply PureScape far UVC lighting. Now these lights are app controlled, and they're made in the USA, and they do come in 3 different styles. The first is a wall mount that you see on the screen right now, and it is a plug and play option. And by that I mean that it does not require professional installation. It should be installed at a minimum of 7 feet above the ground and can disinfect a room of 400 square feet in about 10 minutes or so. That's again going to be the air and the surface in that room. As we heard Kevin say many times, and as we talked about during the Q&A, far UVC lighting does not impact humans, and negatively, it's safe to operate while humans are present. Now, the second style of the PureScape light, direct supply PureScape lighting, is an in-ceiling can unit. This has a low profile and is ideal for drop ceiling installations. Can also be used in retrofit and new construction situations. And it's important, again, to note that kind of similar to what Kevin was noting at the end of the Q&A, that far UVC lighting does not replace traditional lighting. It's not intended for illumination, but it will have a small amount of glow, but not intended for illumination. The third style of the direct supply PureScape far UVC lighting is a pendant unit. Pendant units are appropriate for common areas in any rooms with high ceilings, as they can be situated to work really with any ceiling height. From a design perspective, they also have more of a home-like appearance. And as I noted a moment ago, all of the direct supply PureScape far UVC lighting can be controlled by a free app. The app will help you set the light cycle appropriately based on the ceiling height in your space, and which is inclusive of how high the ceilings are, how often the room is occupied, and other room characteristics. And not only does it ensure safety for the humans living and working in that space, but also extends the useful life of the bulb for the future as well. Now, beyond far UVC, we also carry a plethora of traditional 254 nanometer UVC equipment. Again, this is the type of equipment that is not safe for humans to be around, but it is great if you have a targeted need, such as a terminal clean or an outbreak. It can make use of things like the safe zone or the M15 carts that you see on the slide. These towers can be moved to virtually really anywhere within your community to disinfect the air and the surfaces. The safe zone, I always like to call this out, can actually be used to disinfect transportation vehicles as well. You can take the top of it off of the rolling base and move it into smaller spaces like transportation vehicles that tend to have a lot of potential contaminants as folks come and go from your community. Now, the next item here I'll call out is the UVD robot, which again is an autonomous UVC tower that can save your staff time, and by eliminating the need to reposition within the room, it can drive itself around and cover all those shadowy areas. The UVC chamber that you see on the slide is a handy tabletop device, kind of like a microwave-sized unit, designed really to disinfect smaller devices like cell phones, tablets, medical devices, name badges, radios, that type of stuff in just a couple of minutes. And to verify the efficacy, Kevin alluded to this as well as he was talking about far UVC, but it's important to make use of dosimeter cards. They will tell you if your towers or any of your UVC devices are operating optimally, and also help you to identify any potential shadowy areas in a room as well. There's no silver bullet in infection prevention. So having a combination of all these different devices, both far UVC and traditional UVC, can really be a game changer in improving your infection prevention program. Now, we've recently partnered as well with a company called Backtrack, which uses ATP testing equipment and then aggregates those scores into its innovative software program. It has a user-friendly dashboard that you see, kind of like what you see on the screen here, that it's going to allow you to monitor contamination levels by a variety of different metrics so that you can quickly identify problem areas in your community and then provide and document corrective actions assigned to your environmental staff so that you can actually act upon those things very quickly. It's also going to provide a regional view that lets your corporate and regional heads of infection prevention see how their facilities are performing across an entire, across the country realistically, so they know where they may need to spend a little bit of additional time. It's a very effective, Backtrack is a simple and effective tool to save infection preventionists time while also helping them to comply with CMS guidelines. And it's going to provide that tactical data that I noted before to help reduce contamination and lower the risk of the spread of infection as well. Now, last but certainly not least, no infection prevention and control program is complete without housekeeping and equipment and janitorial supplies. For dirt and soil removal, microfiber cloths and dusters and mops are great tools. Studies over many years have proven them to be a lot more effective than traditional cotton mops. and cloths at removing dirt and even bacteria from surfaces with just the use of plain water. Adding cleaning chemicals, sanitizers, disinfectants to the equation is going to enhance the cleaning effectiveness of microfiber by loosening those stubborn soils, and also permitted that the proper contact time is met, killing pathogens as well. So whether you prefer ready-to-use chemicals, concentrates that you mix yourself, or dilution control chemicals, Direct Supply has you covered. And on top of that, we certainly carry a wide variety of can liners, paper products, soaps, sanitizers, and all the dispensers to go with them. So we really, at the end of the day, can be a one-stop shop for all of the supplies, equipment, and technology that you need to maintain an efficient and effective infection prevention and control program at your community. Now, I realize this may only apply to a small portion of the audience, but I would be remiss if I didn't share a great opportunity to see these new far UVC lights in person and talk with our team. Direct Supply and HomeLike Solutions will actually be exhibiting at the annual Association for Professionals in Infection Control and Epidemiology, known as APIC, the annual conference down in Orlando, Florida, June 26th through the 28th. You can visit us at booth 715 if you're there. And additionally, as you see in the yellow box on your screen, on June 27th, we are hosting a happy hour at Bahama Breeze from 4 to 7 p.m. Food and drinks will be on us. You can scan the QR code on the top right-hand corner of this slide to register for the happy hour. So if you are at APIC or you live in the Orlando area, please join us. There's still time to register for APIC if you are interested. You can go to apic.org for more information on that. For more information and pricing on any of the products that you heard about today, head to Direct Supply's website, store.directsupply.com. You will be able to find helpful resources, check out product availability, place orders, all those good things. And as always, you can contact your Direct Supply account manager with any questions as well. This concludes today's webinar. Thank you for joining us.